Good morning, everyone. Thank you, County Executive Tedesco, for the introduction and for the partnership that really brought us here, and Sheriff Saudino, Prosecutor Callow, Chief of Detectives Angelotti. We're here at Newbridge for a reason, because what we're going to talk about today are the results of an extraordinary and an innovative collaboration between law enforcement, public health professionals, recovery specialists, that brought new options to those suffering from addiction. And the numbers that we'll preview today are nothing short of remarkable. 80%, over 80% of the people touched during this collaborative initiative are in some form of treatment, some form of recovery as we speak. 5 out of 6 of the people we touched are getting the help that they need to battle the disease of addiction. But as the county executive mentioned, it started here in Bergen County. And to understand what we did and what we accomplished this month, I need to talk about what happened here in Bergen County. We made a decision when I was a county prosecutor, not just me alone, but the county executive, the sheriff, and our other partners, and all the detectives that I see from the prosecutor's office. We made a decision that we were going to no longer sweep up low-level drug offenders, that we were no longer going to just sweep them up and put their pictures in the paper and shame them, that we were no longer going to add to the stigma that's already associated with this disease of addiction. Instead, we made a decision that we were going to try something new here in Bergen County. So all of us in law enforcement, the sheriff, myself, folks here at Newbridge, recovery specialists that we worked with, county health officials, we decided to do something different. We decided to offer those that we arrested who were suffering from addiction a treatment option. Not in lieu of arrest, and that's important for me to stress. We weren't giving anybody a free pass, but it was in addition to being arrested. We just didn't want to leave people out there without any sense of hope. And if they weren't ready for treatment right after we arrested them, we kept in touch with them. You'll hear from one of our recovery specialists. I jokingly refer to them as stalkers, but in a good way. They literally would stalk and keep after people, because if they weren't ready in that first moment that they were touched by somebody in law enforcement, these folks were persistent, and they stayed in touch with them. And guess what? That approach, it worked. We called it Operation Helping Hand. And for numerous people over the course of several years, we were able to break that cycle of arrest, overdose, Narcan save, and rearrest. And for numerous other people, we were able to prevent that next overdose fatality. And there are people that we touched during that operation who are here with us this morning, who are doing well and who are working with us. And you'll hear from Matt Albanese in a moment this morning. And so it was no surprise to me that it worked because of the dedication of the people we had here in Bergen County. And what occurred to me is that when I had the honor of becoming the Attorney General this past January, is that what if we all got together and employed this same approach all across the state? What if we brought this new approach where we stopped treating addiction as a law enforcement issue alone, but rather treated it like what it was, or what it is, which is a public health crisis? Could we accomplish the same thing at a statewide level? And given the rate at which we were losing people in this state, we didn't have time to waste. So here we are just 5 months later to tell each of you that it did in fact work. The numbers that we will share with you in a moment are proof of concept, that if we get outside of our comfort zones as law enforcement officers, if we work and partner with the treatment community, if we work and partner with institutions like Newbridge, that we can make a difference. So over the course of the last several months, hundreds of law enforcement professionals, some of whom are in the room this morning, and others got together and they developed a plan. We met with treatment providers and recovery specialists. We lined up treatment options for those that we were going to encounter during the course of this initiative. We lined up beds right here at Newbridge if individuals needed detox. And we touched hundreds of lives during this initiative. And I firmly believe that we saved many, many lives. 5 counties participated in this initiative: Bergen, Morris, Passaic, Sussex, and Union. The counties conducted their operations over the course of 5 days from June 11th through June 15th. And here are the numbers. Out of 177 individuals arrested in this 5-county effort over the course of that week, a total of 148 accepted the treatment option or recovery support services. Again, not in lieu of arrest. And only 29 individuals rejected our offer of help or were otherwise determined to be ineligible for treatment options. And those numbers, folks, that represents 84%, an 84% success rate. 5 out of 6 users arrested expressed a desire to turn their lives around, and we gave them that option. Union County alone, under the leadership of Prosecutor Monahan, had an incredible success rate. 100 individuals arrested in its operation, with 81 of those individuals accepting treatment or support services. Again, you'll hear from Assistant Prosecutor Lindsay Rotolo in a moment, but it was a matter of getting outside of our comfort zones. And instead of just viewing these individuals as defendants, treating them like human beings and navigating the course for them, getting outside of our comfort zones. And because of the successes in Union County, they also had 3 walk-ins, 3 people who had heard about what was going on, who said, I hear you're out there trying to help folks, and I need that help as well. And those 3 individuals were also afforded treatment options, and you'll hear their compelling stories in just a moment. So let me summarize. With the 3 walk-ins, we had a total of 180 users, individuals suffering from addiction, in this combined operation that we touched. 151 of them ended up in some type of treatment or support option. And here's the thing. From prior Operation Helping Hand initiatives that we conducted in this county, we know that people will relapse. We know that we're not going to keep all 151 people in some form of treatment or recovery, but we also know that a substantial number of them will stay in. They will continue with their treatment options. And for those individuals, we've broken that cycle. And if they relapse, we'll be here for them with our recovery specialists, and we will offer them the treatment option once again. Simply put, this Operation Helping Hand works, and in the months to come, I hope to roll it out as a playbook that other county prosecutors use. But I truly hope that law enforcement agencies and prosecutors around the country look to New Jersey and use this as an example of the model, of the new model of how we can attack this addiction crisis. Because if we don't start looking at this problem differently, we have no hope of breaking the cycle. The numbers, when we're sharing some new numbers today, there were 2,221 drug overdose deaths in New Jersey in 2016. Folks, that's 6 per day, and the majority of those were opioid related. And based on the preliminary information which we have for you today for 2017, we know that the death toll will be even higher. And we also know, if you go to our NJ Cares website, where we're trying to track these numbers in real time, we've already had 1,400 drug overdose deaths here in 2018 alone. Again, we're on pace to shatter those numbers. And again, the majority of those are heroin and opioid related, and the majority of them are driven by fentanyl and other synthetic opioids that are being cut into the heroin that's being sold on our streets. And we also know that those numbers would be far higher if it weren't for the brave men and women of law enforcement, the EMTs, the ER physicians who are saving folks every day with naloxone and Narcan, including family members. So clearly the fear of death is not stopping anyone from using or breaking that cycle. We need to change, again, how we address addiction. And don't get me wrong, of course we need to go after those bad doctors and those pill mills. And of course we need to go after the drug organizations that are bringing these poisons into our communities. And of course we need to continue to put pressure on pharmaceutical companies who irresponsibly and fraudulently, as we alleged, prescribed opioids, leading us to this current crisis. And we will continue to do all of that. But what we truly need to do, to truly disrupt this cycle, to truly help folks, is to offer them a helping hand, as we did over the course of a week here in the northern counties. And if we do that, I am fully confident that those numbers that we shared with you today will start trending downwards. So I don't want to take up all the time at this podium this morning. I want to turn it over to our partners in this effort, and I'll thank them all at the end before we take questions. But I want to welcome a real partner in this effort, Deb Moscone from Newbridge. Thank you so much.
Thank you, Attorney General. Thank you all. Today is an incredibly important and moving day for all of us here at Newbridge. I'm Deb Moscone, President and CEO of Newbridge Medical Center, and it's my honor and privilege to host you all here today. Newbridge Medical Center has been involved with Operation Helping Hand from the beginning as a treatment location for those in need of medical detox and subsequent aftercare. When I first heard about this initiative, I remember being so impressed with the vision and innovation from Bergen County officials and law enforcement officials to embrace the fact that prison was not the answer to the opioid epidemic, nor is it the best place for those suffering from substance abuse disorders whose disease has taken them on a path that has forced police intervention. This project unifies all of us to combat this crisis, and we take our role as a treatment center provider to heart, as it truly aligns with our mission to provide quality, compassionate care to all the communities that we serve. With 84 beds, our medical detox program is the largest in the county and was expanded to its current size to address the opioid crisis and support the treatment and recovery needs of our county. To be able to earmark beds for this initiative, guaranteeing an opportunity for those involved in what becomes a life-saving, a life-altering, a transformation opportunity, to have access granted through Operation Helping Hand to this expert care that we provide here at Newbridge Medical Center. It's at a critical juncture in their lives, and it's an honor and a responsibility that we take very seriously. The right moment, the right reason, the right location, and the right treatment team equates to the right methodology to help mitigate an epidemic of sizable proportion. And my friends and colleagues, this epidemic knows no socioeconomic, age, gender, or ethnic boundaries. For us, each day, we work to change the perception of those who still view addiction as a moral failing, who only see the scars of the addiction, not the heart of the patient needing help. This is what we strive for at Newbridge Medical Center, to see and treat people with the disease of addiction with the same compassion as any other patient with any other disease. At Newbridge Medical Center, we stand proud to be stigma-free and proud to be part and continuously support Operation Helping Hand. My friends, together we will save and transform lives. Thank you for being here.
Hi everyone, good morning.
Good morning.
My name is Matt Albanese. I was addicted to heroin for 7 years. It took me a long time to finally surrender. The last time I got arrested, I didn't realize that I was about to get set back on the right path. And thanks to Operation Helping Hand and Newbridge and all its staff members, I have my life back. And I'm very happy that the stigma is getting lifted because you don't know the person underneath the addiction. I myself am an artist, and I've met some of the most interesting people in my life through programs, meetings, inpatients, detox. And a year ago, I came here in handcuffs, and now I work here. I work. And now I get to meet other addicts constantly, and having conversations with them about the struggle means the world to me. And if I could get into any more programs or do any more work to volunteer or charity work to help other addicts, it'd be my honor, because being up here, I think about the family and the friends that I've lost. That number is high, and I don't want to see anybody else go. So I'm here to help. Thank you.
Good morning. My name is Camelia Valdes, and I have the distinction of serving as the Passaic County Prosecutor. And together with my colleagues from Morris County, Bergen County, and Sussex County, we launched Operation Helping Hand in Paterson. And what we found was that this was another example of the extraordinary power of collaboration. When I arrived on the first day of the operation to my Totowa office, I found that there were 150 police officers in our Totowa building. And I'm usually used to watching a lot of police officers, but not that many. And under the direction of our narcotics task force that did such a tremendous job in organizing 150 police officers from all 4 counties that represented Patterson PD, the sheriff's departments of Bergen and Passaic, and so many of the municipalities that are all touched by what is happening with the heroin crisis in Patterson. They came together to look at this problem that we know we have in a different way. Alongside the police officers that we welcomed, we also welcomed recovery specialists to our Totowa facility. And those recovery specialists aided that operation and informed us of the things that we necessarily would not have had exposure to had it not been for Operation Helping Hand. And by that I mean, once someone is arrested, what happens to them? Exactly, especially when we know that they are suffering from addiction. And those recovery specialists were able to share with us some of the observations from their world that really informs the work that law enforcement has to do. And because we all know that it takes a village, Eva's Village was our main partner in Patterson, and Eva's Village and their representatives helped us to really understand that, as has been alluded to, when we are talking about working with people who are suffering from addiction, you have to treat the whole person. What led them there? And once they get the treatment, and sometimes they don't accept it the first time, and sometimes they don't accept it the second or third or fourth time, we have to keep at it to understand why is it that they're there and why is it that they're coming into contact with the criminal justice system. Operation Helping Hand gave us an opportunity to work outside of our own silos and reach across to recovery specialists who knew what got them there and what would keep them from that path. We were certainly encouraged and extraordinarily grateful to be able to talk to people who have been suffering from addiction, and in Passaic County, as in the majority of our counties, typically it's a 3-tier approach. So we focus on users, we focus on sellers, but for me personally, I can tell you that I'm also focused on all of the people in between that are not users or sellers, that are Pattersonians that are trying to get up and do the right thing and go on with their lives, who are also impacted by addiction. Because when one person is addicted, that entire family and that entire community is addicted. And so I am certainly encouraged by what I saw, the partnership, the laying down of the gauntlet between all of our police officers who wanted to really get it right, and who understand that arresting is just the beginning of the story. What happens in the end of the story? And certainly I am looking forward to continuing into that fight and that struggle and humanistically treating the whole person, not as a defendant, but as a person who needs help. Thank you.
Good morning. I'm Lindsay Rotolo. I'm an assistant prosecutor in Union County. And before I start, I just want to say 2 quick thank yous to the Attorney General and his staff and the Bergen County Prosecutor's Office and your staff. Thank you for leading by example and supporting us as we took on this endeavor in Union County. Without you, we would not have been able to expand on the insightful community outreach program that you started. And a thank you to the leadership in my office, Prosecutor Monahan, Chief Gagliardi, and the director of our unit, Julie Peterman. From the very beginning, you saw the potential impact this could have on Union County, and you signed us up and took on this incredible endeavor, and we tried to make it work. You'll also hear from Sergeant Webb, who was instrumental in that. I've never been more proud to be part of that office. So we encountered over 100 people in the course of 5 days. So there are a lot of lessons to be learned from that, but I want to talk to you briefly about 2 lessons, 2 takeaways from our week in Operation Helping Hand, Part 1, Union County, where I think these lessons can expand beyond law enforcement. And so to illustrate these lessons, I want to talk to you about some of our participants. So on day 1, we had a participant who came in, and right off the bat, he wanted detox. But he wanted an appointment on Wednesday morning. And we should have been suspect about what it would take to get ready for 2 days for detox, but we went along with it and we secured him a bed on Wednesday morning. And then we processed him and he went home. And our very first arrest of Tuesday morning was participant S again. So he comes into the processing room and I look at Mr. S and I said, Mr. S, we have a bed for you tomorrow. What are you doing here? And he gave me this puckish grin and said, well, today isn't tomorrow. And so he was processed and he insisted that he was going to be there for his bed. I asked him if he would be safe that night and he promised, I will be there tomorrow. we encountered him yet again. And then tomorrow came, and Wednesday morning came, and we went to pick him up for his detox bed. Our officers went to the place he said he would be, and he wasn't there, but he was in the immediate area. So when they came to him, they said, you know, why weren't you waiting for us? Do you not want your detox bed? And he said, no, I want it. I just had to get my friend. You see, Mr. S was recruiting additional participants for us, and he was responsible for our first walk-in, our first of a few. And there she was, no arrest, no charges to speak of, but she voluntarily showed up at headquarters to be linked up with a recovery specialist, and both our walk-in and Mr. S went to detox that night. And what can we glean from that story? Well, it's that there is a tremendous need for help, and there are incredible organizations doing it, but there's a disconnect between the need for help and the availability and connecting those two groups. And for a week, Operation Helping Hand was able to do that. And with the Attorney General's expanding this program, we see that there's a potential for that to grow. And the second really quick story is about our very first participant who set the tone for the whole week for us. Participant number 1 believed we were tricking him. He told his arresting officer when he said he was going to be introduced to a recovery specialist, this is a trick, this is a trick, this is a trick. And when he met with the recovery specialist, this is a trick, but in case it's not, let's see how this plays out. Get me a detox bed today. So we put a plan in action. We were able to get a clinician on an appropriate facility on the other line to do a phone screening. We transported participant number 1 to a private room. I put my cell phone on the desk on speakerphone so that he could do his phone screening. And as I went to leave, he stopped me, and for the first time he said, wait, you guys are really going to do what you promised you would do? And I said, of course. At that moment, everything about him changed. His body language, his demeanor, his voice dropped, and he looked at me so seriously and with such emotion, and he said, I cannot believe I'm about to say this to the people who just arrested me, but thank you. Thank you for bothering to care. And everyone in the room was struck by what that meant. It meant we recognized that there is a transformative power in unexpected kindness. And so those are the two takeaways that go beyond law enforcement. There is an incredible need for help. And if we all of the people of New Jersey, not just police officers, not just prosecutors, not just recovery specialists, but if everyone started to meet that need with unexpected and unimaginable kindness, perhaps the spirit of Operation Helping Hand and the operation itself can just spread. So thank you very much.
I thought they were going to save the best for last. Oh, well, shucks. Hi, everyone. Good morning. My name is Constance Rizzo, and I'm a certified recovery practitioner specialist along with many other titles. I'm a mother, I'm a daughter, I'm a sister. I'm a woman in long-term recovery. And it's funny, when I first came in, actually this morning we had 2 deployments from 2 different hospitals. And also all the arrests in Bergen County and Passaic County are in court this morning. So a lot of the people I worked with a few weeks ago, I wanted to support and show up in court. So I was able just to go down there and so they could see my face and let them know everything was going to be okay. Some of them thought they were going to jail. Some of them thought they were being indicted, that they had to bring in a big drug kingpin in. And I kind of put them at ease. So when I walk in, I go into my boss tells me to go into the conference room, and there are all the prosecutors, the attorney general, and all these people. And I met, and we schmoozed a little bit. And then they told us to come back here. And it was funny, little old me, I'm like leading the pact. I realized that. I'm leading the pact. And 2006, I was facing a 12-year prison sentence. And here I am today, not here to impress anyone, just here to help people, speak the truth, live the dream. And there's a lot of people here that I could thank. Most of all, my superiors, Ellen Elias, who's the Vice President of Children's Aid and Family Service, Elaine Hernandez, who's the Director, Ellen Cilio, who's our Patient Navigator, Mike over here, Paello, who's the Director of this. We have Hector over there, Jason Hofstra, all the officers in the back. I don't know all their names. Cindy Marie, who runs Eva's Village, Joe, who's one of the recovery specialists. There's so many people here that I could shout out. Sue Debiak, who's the Director of the county, I'm sorry I forget your name, and so many people. And most of all, Madam Prosecutor, who is definitely dedicated. And at one of the Operation Helping Hands, I've been doing this since the conception of it last year, so I've been to all 4 of them. And it started out a little shaky. By the last one that we did 2 weeks ago, it was incredible. I'm here to speak and be an advocate for the ones that don't have a voice, because the power of addiction and how addiction affects everyone so many different ways. I've had clients that are 19 that were going to play football, had a full scholarship at Penn State, who had an injury, started out with opiates, and then was shooting dope in Patterson, living in an abandoned building, to a 66-year-old woman who works for the UN, has 2 masters, and is on the streets of Patterson from a knee injury that she had later on in life, couldn't take the pain, and everything in between. Everything in between. And when I meet with these people, the phenomenon of the connection that we have, the empathy and the compassion, and I need to say, working with law enforcement, and all of you men have badges and honor, and you go out every day into the field, and you don't know if you're coming home or not, because those streets are rough. There's stuff going on out there that is traumatic, that is so devastating. And the law enforcement, what I have seen happen, the compassion and the empathy and the way these people that are addicted are treated now, because there was a stigma. There always has been a stigma. I was stigmatized. You know, stepping away. What do you have? What's in your pockets? Am I going to get HIV? Just the fear of so many stigmas. But we're going into this now, and I've seen the officers bring people in and not being rough with them, not handling them in ways that they might have been handled 20 years ago or 10 years ago. One of the officers, I don't think he's here, there were 2 young women that were missing and that were out on the streets of Patterson for a long time, and they were both pulled in. And one was a victim of sex trafficking, held against her will. And then another one was just stuck out there with a needle in her arm. And we were able to bring them both in, and I met with both these women. And I thought, oh boy, why me? What can I do? How can I approach this situation without saying the wrong thing? And something, you know, miraculous happened. They're both in treatment. One is in treatment here. She went through detox. Now she's in rehab, going on to a halfway house. The other one is out in New Hope. And I called the officers, because one of the officers stayed with me here till 9 p.m. at night. He didn't have to. His shift was over at 4 or 5. He stayed here till 9 o'clock. It was incredible. So when she was getting well, I called him and I said, I'm here with Kay. I'd like you to speak to her. She's so thankful for what you did. And we called him at a time that he was just toe tagging a body that just overdosed, a young guy. He said, you couldn't have called me at a better time. I had a good upbringing. Drugs I thought would never be part of my story. It wasn't supposed to be. But addiction doesn't, you know, discriminate. As you said, it comes from all walks of life. And when Attorney General Grewal started this whole thing last year, our first one, it was, you know, we were learning. And by this one now, we were the ones that helped all these other counties. I was back and forth from Passaic County to Bergen County, and I just know that I never want to ask myself or have any regrets. Did I do enough? Because over the past year, I've seen young people die. And what do I say to their parents? And my first thought was, did I do enough? Could I have done more? But I think as long as all of us as a team and coming from the top, we do our part, really do our part, speak our truth, talk about how you feel. How is it? It's traumatizing. I need to talk about what it's like out in the field. When I'm in the trenches every day, man. I see stuff that it's like a horror show. It's in the movies. And be compassionate, be loving. Someone said an act of kindness. It's all about kindness, right? Believing in people till they believe in themselves, getting a safe environment for them. Because that first year, that first 90 days of recovery is so critical. It's not like 3 to 5 days in detox. Bye, see you later. No, they wind up back in the street, then they wind up dead. So it's an honor to be here. And I am a little nervous. I'm sitting here, my inside's like, I want to say more. I think I should say more. But I guess I've said what I need to say. I want to thank you all for giving us a chance, believing in us, and having us turn our lives around, that I could stand here. I've been in every area of this hospital, but I could stand here today as a mother of a 27-year-old daughter who's going for her PhD, who will never use drugs, will not have a history of drugs, and through my pain, I've taught her what it's like to be a responsible member of society. And no matter what I come from, my struggles have allowed me to find my strengths. Through my darkness, I have found my light. Thank you.
Good morning. I'm Sergeant Gary Webb from Union County Prosecutor's Office, and we've heard so much positive feedback about Operation Helping Hand today, and I just wanted to share a little bit of the law enforcement perspective and the incredible impact it had on the officers assigned to our operation. Back in February, Prosecutor Monahan asked us to attend a meeting in Bergen County about Operation Helping Hand and learn what the program was. And quite honestly, when we left that meeting, we were really unsure if this could be a successful program in Union County. But with the prosecutor's encouragement, we took on the task and said, we really need to be a part of such a meaningful project and get involved, and we thought it was very important. And something Prosecutor Monahan said back then that really resonated with me was that even throughout this entire operation, if we can only help one person, the entire operation was a success. If we can help that one person, we've done our job. You see in law enforcement, especially in narcotics, we typically only deal with people during the arrest process, and very rarely do we get a picture into their personal life. We don't hear about their daily struggle with addiction, and we don't learn about their story. But during this operation, we really had an opportunity to do that, and it was something truly special for our officers. We heard about people that have been addicted to drugs for 20-plus years and have tried rehab or couldn't get into a program for financial reasons or insurance purposes, or they've relapsed and have been to multiple programs. And I think it was so encouraging for our officers to see that we were able to get people immediately help. I can remember a story of a gentleman that had been on a waiting list for 3 months to get into a rehab program, and we got him in that day. Our officers literally drove him to detox that afternoon. And just for our officers to see that, it was really encouraging to learn about that process and learn about the struggle of addiction. And I personally had multiple officers come up to me and just say, thank you. Thank you for allowing me to be a part of this operation. It has truly changed my perspective on the opioid addiction crisis and how I view people with addiction. And, I think the most important part about that was, though, the people that we arrested and the people that we sought help for was they saw how committed we were. There was literally nothing that we wouldn't do to try to get people into treatment immediately. We cleared warrants. We gave people rides to their home to get their clothes, to get their medication, to take their dog out. We even drove one gentleman to his house to pay his rent so that if he went into an inpatient rehab program, he wouldn't get evicted from his apartment before he went there. The experience was just truly incredible. I'd just like to say, though, we are not naive to believe that all 83 people that we got into treatment or got help will ultimately beat their addiction. We know inevitably that they will probably relapse. They'll stumble along the way. And we just want to reach out to them and say that if you do need our help in the future, this wasn't a one-week program. We are here to help. We will continue to help. And I'd just like to close with saying that this was really a special week here at Union County Prosecutor's Office, especially those of us on the law enforcement side. I know I can speak from experience that it truly changed my perspective, and it's something that all of us will remember and hope that we could do again in the future. Thank you.